In a remarkable partnership, the European Union and the World Health Organization joined forces to tackle the challenges of COVID-19 vaccination in Africa's most fragile humanitarian settings. With a generous investment of 16 million euros, the EU-funded project implemented by WHO has achieved significant milestones across 16 countries over the past 2 years. These countries have successfully boosted COVID-19 vaccination rates from an average of less than 5% to nearly 30%. 34 million people have received full course of vaccinations. That is, more than 1 in 4 people across the population of all countries. The progress has been remarkable. 6 of the countries, Chad, Guinea, Niger, Sudan, South Sudan, and Nigeria, have reached close to 40% vaccination rates. A few others, like the Central African Republic, Mozambique, and Somalia, have surpassed the 40% rate. In Liberia, showing the most progress, 8 out of 10 people are now vaccinated. A key objective has been to prioritize the most vulnerable people and communities, including health workers, older people, and those enduring humanitarian crises. Vaccination efforts reach close to 12 million refugees, internally displaced people and migrants across 11 countries. 4 in 10 of them were fully vaccinated, and more than half of them received at least 1 dose. Close to 13 million people amongst these especially vulnerable groups were reached with awareness campaigns, delivered in their settings and in their languages by local health workers. Tremendous progress has also been made in vaccinating older people. Close to 26 million older people, 38% of the total in all countries, completed their primary vaccine series, providing crucial protection against COVID-19.
Vaccination is a good thing. I want everyone to get vaccinated. I took the COVID vaccine 4 times. I want each of you to go get vaccinated because the vaccine solves a lot of health problems.
Thanks to this EU-WHO collaboration, people's lives in Africa's most vulnerable communities are being saved. Health workers, community mobilizers, and project teams are working together to achieve remarkable results. And the success story goes beyond protecting individual lives. This project is a long-term investment in building stronger capacity to prepare for and respond to outbreaks and other health emergencies. Improvements in cold chains and logistics ensured the effective delivery of vaccines to remote and vulnerable populations. Awareness about the COVID-19 vaccines was increased amongst the health community, and confidence of its efficacy conveyed.
To avoid COVID-19, you must agree to be vaccinated. If you notice any side effects, it's necessary to consult a doctor.
By mid-2023, the number of health workers trained to deliver vaccinations skyrocketed from 130,000 to almost 2 million. These trained health workers are a precious and resilient asset for national governments and communities, as they are prepared and ready to provide an effective response to any future epidemics. With significant knowledge transfer, training, and fieldwork, the national vaccination and immunization programs have been strengthened in the long run. Countries are now more resilient against COVID-19 and ready to tackle other vaccine-preventable diseases and health emergencies. This increased resilience helps communities to be better prepared for addressing current and future epidemics. In many of the countries, governments are updating their national vaccination and deployment plans, integrating COVID-19 vaccinations to enhance vaccination efforts and data into existing health systems and services. This allows improvements, for example, better monitoring, tracking, and evaluation, enabling services to reach priority populations more effectively. Countries are also conducting self-assessments to identify areas for improvement and tailor strategies to maximize the impact of vaccination campaigns. The European Union and the World Health Organization continue to work hand in hand, making a lasting impact on global health through this long-standing strategic partnership, with the ripple effects already being felt. In addition to protecting millions of people from COVID-19, more robust and resilient health systems are being built to better equip these countries to protect their populations from future outbreaks and health emergencies.